There are two types of implants that are used for breast augmentation. One type is called saline and the other type is called silicone. The vast majority of patients choose to use silicone implants. These are FDA-approved implants. The latest generation is called a cohesive implant, or that type of gummy bear implant that lots of people like nowadays. I would say that the vast majority, probably at least 95% of patients, choose to have a silicone implant. Most commonly, incisions for the breast augmentation are placed underneath the fold of the breast. This is a nice and hidden location for patients to conceal their incision. Capsular contracture is scar tissue that forms around anything we put in the body, whether or not that's a hip replacement or a breast implant. Sometimes over the years, that scar tissue that forms around the breast implant can sometimes become high, tight, and firm. Sometimes patients over the years need to have a second surgery to help loosen up some of that scar tissue. A Keller funnel is a very fun tool to use. It's almost like a very fancy type of icing bag. And what we do is that we place the implant inside of this bag and then use that to place that inside of the patient. The reason for doing this is that the funnel protects the implant from ever touching my hands or your skin, and that way it helps keep bacteria off of the implant altogether. We know that the Keller funnel helps to decrease the risk of infection and capsular contracture. This is a great tool for safety that I use for all of my cosmetic patients. Choosing the right implant size is a very personal and patient-specific decision. We'll take measurements together at your appointment and we will go through implants that help fit your body, and we'll take that into consideration with your own personal expectations and desires. Breast augmentation recovery tends to be on the shorter side. We often ask that patients take 3 to 7 days off of work to help recover from the surgery. We ask you to keep your activity low and avoid going to the gym for 1 month afterwards, and then you have no activity restrictions after. You can breastfeed after having a breast augmentation. As we know, breastfeeding is a bit of a mixed bag for patients in general, but it is possible to breastfeed after having a breast augmentation. It is a common misconception that you need to have your breast implants replaced every 10 years. In fact, if your implants are not causing you any problems, if you have not had any rupture, no capsular contracture, if you are happy with the appearance of your implants, you don't need to have more surgery.